So Innovation Factory is here with Kirsch today, the Chief Marketing Officer of Sisu Global Health. Katie, thank you so much for being here today. Can you tell us a little bit about Sisu Global Health?
Yeah, Sisu Global Health is a medical technology company for emerging markets, specifically Sub-Saharan Africa. And so we work with stakeholders on the ground in these locations in order to create medical devices that make sense in different infrastructures and with different challenges in general. We're also looking at different applications at the military and other places around the world.
Awesome. So how did you get the idea for the business, and what is your mission at the outset?
So the original concept for the device that we're working on has to do with blood conservation. Mm-hmm. And so one of the biggest issues in a lot of places, including Sub-Saharan Africa, is it's very difficult to get donor blood to the various places. And so one of my colleagues and myself also did some observations in hospitals in Ghana, where we were able to observe a surgery that involved using a soup ladle and gauze to scoop blood out of a person's internal cavity and put it through gauze and back into a blood bag. This is basically a simple method for what's called autologous blood transfusion, or just recycling and resalvaging your own blood. We do it a lot in the US too, but this particular instance is a way they save lives in a lot of places, and this is something that brought the kind of engineering spec from my colleague to really create something that would make a big difference.
So how do you distinguish your company from other nonprofit companies?
Okay, yeah, we work. We are a for-profit company, and we work through that because we believe that in order to scale, in order to make the biggest impact, we need to be able to be financially stable and financially subsistent. Many nonprofits do have a good donor base and that sort of support. However, we want to be subsistent on our own and not based off of fundraising constantly, which is what often happens with many nonprofits.
What's the next big plan, and what help do you need at this point?
So we actually just got back from a fabulous trip in Zimbabwe, where we made a lot of great connections in order to plan our first clinical pilot test. So using it on patients this summer. So we're working with some doctors there to create the protocol, work with them, with their groups there to do that. And I think the biggest things that we need help on that is just enabling them to be able to work through their channels and working on some of the regulatory and some of the biocompatibility pieces that we're testing currently.
What did you learn during the process of starting up your business?
You learn that starting a business is going to absorb your entire life.
Yeah.
It's not anything 9 to 5. I've heard people say, well, how many hours do you plan to work on something? It has to be something that you really believe in and be really passionate about, because you're going to spend a lot of time on it. And I think some of those learnings come from that, is that it's very helpful to be passionate about what you do, because I think it helps you get out of bed every morning and really focus on what's important in what you're doing in everyday life.
So if you have a advice for future Hopkins entrepreneurs, what would that be?
I would say don't be afraid of people putting down your idea, especially when it's a very early stage. I think it's one of the biggest things that prevents a lot of minority and female entrepreneurs from getting started, is people saying, well, that's not a real idea. If you really think it is something that can work, find some evidence about how it does work and just keep building off of that, and don't be discouraged by the first naysayers that come around at the beginning.
Inspiring. So my last question is, what would you say are the top 3 skills needed to be a successful entrepreneur?
So the top 3 skills to be an entrepreneur, I think that's something that you need to be able to cooperate with your co-founders. I think that's one of the biggest things. You should never do something like this alone, and so be very understanding and know who you're working with and able to work with them. I mean, they become your, startup wives or husbands. You see them probably more than your own significant other. So that would be the first thing, is being able to cooperate with your colleagues in a positive way that moves the business forward. The second thing I think would be just being persistent and able to kind of persevere against a lot of the things that there's going to be a lot of things thrown at you that make it feel like it seems impossible, but just taking those things bit by bit in order to persevere. And the third thing I would say is to don't be afraid to be creative. I think there's a lot of intent that there's a certain pathway you have to take in order to receive funding or do certain things. Don't be afraid of things like crowdfunding that are coming out or other things to get you through a tight spot when the funding is low and you just need a little more cash. I think creativity, there's no real pathway that's prescribed, even if with all the accelerators and things that say maybe there is, there's no real prescribed pathway to start a business, and so creativity is really essential.
That's great. So is there anything you'd like to add?
If anyone is looking for expertise in the global health field, come talk to us at Dream It Health, but also keep going and start with those little ideas and enter a lot of competitions. They are a really great way to start things off and validate what you do and even just give you the advice you need to move forward.
Awesome. Thank you so much, Katie.